Moving on, and the World Health Organization says the world is in danger of losing hard-won gains in the fight against COVID-19. It says the highly transmissible Delta variant is spreading in more than two-thirds of all countries, with the global vaccination gap aiding the spread. Now, this map shows vaccine doses administered per 100 people across the world, and countries shaded in darker blue have a higher vaccination rate. In Africa, just 1.5% of the population has been vaccinated.
Nancy Ndanu died of coronavirus. She was 27 years old.
The problem which caused the death of my daughter is that, first of all, there was no enough vaccination in this country.
Like more than 98% of Africans, Nancy did not have access to a vaccine in her homeland of Kenya.
We had so many plans together.
Until the vaccination rates are high, people will continue to die, people will continue to get sick, and we allow to exist the breeding ground of new variants that will make people sicker, that will spread to areas that we think are now safe, and we will erode not only the health of the populations that we're working with now, but we'll erode the health of the gains that we've made within countries such as the United States and Europe that do have those high vaccination rates.
The World Health Organization is highlighting the urgency of the problem.
Do you really accept 1.5% vaccination in Africa, while in some countries it's already 70%? The world is actually morally, epidemiologically, and economically is doing the wrong things.
There are huge discrepancies between vaccination levels. In Israel, most of the population has already received 2 jabs, and some are getting ready to receive a 3rd booster shot. Meanwhile, other countries like Kenya are lagging far behind.
The fact of the matter is nobody, not here in the UK, not in the United States, not in Germany, nobody's going to be safe until everybody's safe.
At the last G7 summit, the richest nations agreed to donate 1 billion vaccine doses to developing countries, but not to allow a patent waiver. China appears ready to exploit that vacuum by sharing its technology. Sinovac has always known that a pandemic has no borders. The SARS outbreak 20 years ago was also a global pandemic. A massive drive is needed to vaccinate the world before more variants of COVID-19 emerge.
We keep asking for magic dust. It doesn't exist. The one magic dust we do have is vaccination. Problem is, we're not sprinting that evenly around the world, and we're working against ourselves.
If preventing deaths like Nancy's does not motivate high-income countries to show more solidarity, perhaps self-interest will.
More than 1 million people are in lockdown in China, in the country's worst coronavirus outbreak in months. The Delta variant is driving a surge in cases in the eastern city of Nanjing. Authorities are mass testing the population of 9 million people. And cases have also reached Beijing and several provinces.
Lockdown, mass testing and contact tracing. Same drill, different virus variant. This time to combat the more transmissible Delta strain. A rise of cases in China has been linked to a cluster in the eastern province of Jiangsu, where cleaners at an airport in Nanjing tested positive 2 weeks ago. Officials were keen to assert they were on top of the situation. At the moment, the 190 confirmed cases are all receiving medical treatment in the hospital in Nanjing. All the patients are in a stable condition. On the 30th of July, 1 severe case was downgraded to a general one, while 1 general case became severe. Both are in a stable condition. 1 asymptomatic case is currently under quarantine for treatment in the hospital. China's disciplinary watchdog blamed Nanjing airport officials for poor supervision. The Health Commission has since taken measures to disinfect the site. The coming days will show if that, plus Nanjing testing all of its 9.2 million residents twice, will help arrest Delta's spread.